Dr. Narona had pinned me down to this earlier, and we do this every time that we are an organization से हाँ ये होना चाहिए ये करना चाहिए मगर ये होना चाहिए करना चाहिए से बात नहीं होते. We look for ownership कि कौन आगे आएगा कहेगा ये मैं कर सकती हूँ या मैं कर सकता हूँ या मेरी संस्था इसमें मदद देगी. तो as we've been listening, the overwhelming problem is बाहर जो हम बोल रहे थे कि टाटा हॉस्पिटल की और जगह में भी सेंटर्स आ रहे हैं और यहाँ इतने पेशेंट्स हैं कि जो है उनको बिल्कुल फुर्सत नहीं है अपने काम में. तो we don't want that kind of situation to develop at the other locations. We know that they're doing well. All the other hospitals, Varanasi, etc., are doing extremely well. और जो बढ़ रहे हैं वहाँ भी तो पेशेंट्स बढ़ने वाले हैं when you consider Guwahati, Vizag and so on. So we should think now कि आगे का क्या है. So we're looking for navigators, 5 for outside Bombay and 1 manager as a kind of network. See, basically you have to think of Lung Connect as a network which we hope to grow. This was the theme of this time's conference, that we've begun here, we're doing well here, we're connecting with patients all over, but how do we take the organization itself forward? So this is just a thought I'm leaving with all the NGOs over here. Could you all please think about, I mean, I'm not pinning people down to commit today. If somebody wants to raise their hand and say, yes, we can help with any of the things we're talking about, well and good. Otherwise, everybody knows Sanjeev is here who will take care of the things going forward. As we, from the first session, we learned that one problem, as we said, besides the navigators, which I'm hoping if anybody has to say, raise your hands, or like I said, connect to Sanjeev later. Financial help for investigations, that has been a recurring theme. I think it was an education for everybody of the needs that are there. So if there are any sources of funding for that, please, please step forward. For 25 lakhs for 250 patients and emergency funds of 30 lakhs for 60 patients. Any organization willing to help towards this, please, anybody willing to commit anything now that they can help with or consider it? हाँ, संजीव से बात कर सकते हैं बाद में अगर कुछ कहना बोलना है तो. Accommodation, always, हर साल जब हम मिलते हैं ऑनलाइन और फिजिकली हमेशा बात आती है accommodation की. At this time, doctor has been very specific, accommodation near the hospital. So, and I could pin somebody in the room down, but I like her too much to do it. But we do know of accommodation relatively close to the hospital, I think, which is not being used fully. So perhaps that is something which could be tapped in a longer situation. बात हो सकती है उसके में. Doctors explained the importance of the PICC line being available for patients, and and this, she says that we're looking for 10 PICC line per patient, 10 patients to be accommodated, to be inserted to the PICC line every month. I think this is something which can easily be picked up by any small NGO also who is raising funds for this thing. And then the drugs. We've discussed this, and this has been the recurring theme in our past meetings, that the social work department is able to help patients who are in the lower category. Aha, I just spoke about you and you walked in without mentioning you. Anyway, so we've always talked about the inability of patients from the middle class to afford. That was a recurring theme again today. And in the past, we've had people like Madad come forward for this. So looking for support for about 25 more patients in the year. And then again, I think the NGS tests for 30 patients a month in continuation of the current support. So please contact Sanjeev. If anybody can think about it, take this message back, discuss within your committees and teams and so on, and check if you all can do anything to help Lung Connect. Because this is something, as we know, Lung Connect is not able to do this without the support of the others. Thank you. if I can get one person to raise their hands about something, no, I'll feel, chalo, kuch to hua. Yeah, Sanjeev, aapko mil gaya. Particularly, he has already committed to about forming the organization, but aur kisi ke liye bhi, Venkat's there to help us. Thank you. And that's a big one. Unse help milna bahut badi baat.
Thank you so much for reminding us again about all the things that we need to do. We are